Hi, my name is Erin and I'm an assistant professor at the Northern Ontario School of Medicine in the Human Sciences Division. I'm also the chair of MERLIN, which stands for the Medical Education Research Lab in the North, which is all about supporting and advancing and building capacity for medical education research and scholarship. Today's presentation is titled Preparing Students for Rural Careers. What does the literature say? I'm going to be sharing the results from a larger study, which the full title of the study is Preparing Students for Rural Careers, Examining the Learning Processes and Outcomes in Rural Medical Education in Canada. This study is focused and hopefully will provide valuable insights into the promising pedagogical strategies that support rural competencies, attitudes, and identities that will effectively prepare medical students to pursue rural careers. It's part of a two-part study. The first part, which is a scoping review, and that's what I'll be sharing some preliminary results from this review, is to look at the literature and the general literature of how do professional programs prepare students for rural careers. The second part of the larger study is we'll conduct key informant interviews and sequential focus groups to understand how medical schools in Canada are approaching rural medical education more specifically. So within this presentation, as I said earlier, I'm going to be focusing on some preliminary reviews that we've been looking at and sharing some of the results that we've conducted thus far, and which we'll refine our search and it'll be part of a much broader scoping review that will help to inform the larger project. So this project is a funded project by the Social Sciences and Humanities Research Council, SSHRC. It's a tri-council funded project. And I'd just like to acknowledge the research team. So myself, Dr. Erin Cameron, other members of the team are Dr. Hoy Chu, Dr. Morella Stroink, research assistants Holly Flemming, Hafsa Siddiqui, and Devin Lee are all key members of the team. We'd also like to acknowledge the Health Sciences Library at NOSM, and specifically Sophie Regalado, who has really helped to inform this scoping review protocol and approaches that we're taking within this study. So to just situate the study, in Canada, most rural physicians practice family medicine characterized by a broad scope of practice and a commitment to community needs. Often described in terms of relationality, patient-centeredness, complexity, and holistic, generalist medicine has often struggled against specialist medicine, seen as more prestigious and attractive. As a result, in 2016, a collaborative task force was convened to look at the evidence for advancing rural medicine in Canada and develop recommendations. And the outcome of those recommendations were really a rural roadmap for action and some key directions. While policy and access and research recommendations were listed in the rural roadmap, the call to advance educational practices to improve rural competencies was identified as a key priority and a key recommendation. Over the past 2 decades, researchers in nursing, social work, and medicine have been working to articulate rural competencies. Again, this growth of idea of how do we support those for rural careers. This work builds from the idea that professionals wishing to practice in low-resource, underserviced communities or see a diverse patient base may encounter challenges that require additional skills and attitudes. In the literature thus far, a number of competencies and additional non-clinical skills have been identified as adaptability, living with scarcity, resilience, integrity, reflective practice, collaboration, and more recently that have been added to the list of rural competencies is comprehensiveness, agency, and courage. But while we have identified these competencies, a few studies have noted that there's a gap in the literature about how to develop these competencies. In a recent review from 2018, Sherbert and colleagues examined approaches to rural generalist medicine and highlighted strategies such as pathways, programs, and different models, and they identified key barriers and enablers within this body of literature. But they also suggest that there is a need and an opportunity to undertake and publish more systematic research in this area. Increasingly, there's a need to better understand the complex factors that contribute to the development of non-medical competencies, attitudes, and identities within local programs within the national landscape. So for this research and the research that we're undertaking in how do we prepare students for rural careers, we're undertaking a scoping review, and so we've developed a protocol to undertake the scoping review. The question that's grounding our protocol is what is known about educational strategies that effectively prepare post-secondary students for rural careers. And you'll note that the word health is not there because our protocol and really we're trying to look broadly into the literature about what do we know about what effectively prepares students for undertaking rural careers, again, focusing on those general competencies as I expressed before. Our criteria of including research is it's published in English, published between the years 2000 and now. It's focused on education, and we have a number of terms that we're including in our review. We're also focused from both Australia, Scandinavia, and North America, because that's where a lot of and most of the literature to date in rural education has been published. We're also broadly looking at professional programs and careers, so healthcare and medicine is part of that, but we're also including education, social work, law, engineering, accounting, and business, and we're focused on post-secondary education. In terms of how some of the concepts in our question are defined, so we're defining effectiveness as does the research that's been conducted, or does the manuscript does it demonstrate evidence of change or impact? So making sure that it's showing effectiveness, that's to be included. We're focused on educational strategies, which we're broadly defining as any activities that promotes knowledge, including traditional in-class curriculum, but also non-traditional methods of teaching and learning. And as we know in the literature with medicine, a lot of literature that has been published is focused on rural placement, so that would be included. And then broadly defining rural careers as professional careers that include rural practice as their primary focus. And again, broadly conceived in professional programs. So to date, our search has included we conducted the search in Signal and Medline to find articles that aligned with our research protocol. We worked with the NOSM library to conduct this literature search, so thank you to Sophie. From the initial search, 1,153 articles were retrieved. These articles then went through an abstract review conducted independently by 2 researchers. From this review, we found 17 duplicates and excluded 1,027 articles, which left us with 126 that went to full paper review. During the abstract review, there was a 94% correlation between the 2 researchers, which is on par in terms of a good consistency, with 6% of the articles differing between the 2, and we did bring in a 3rd researcher to help with any of the inconsistencies and make a decision on whether to include or exclude. The full paper review was then divided between 2 researchers to determine, again, which ones would be included, met the including criteria, and which would be excluded. So to date, we have 41 articles that have been included in this preliminary review. So our results to date in this preliminary review, the majority of the articles have been quantitative that have met the inclusion criteria and that very closely followed by mixed methods articles. In terms of the type of rural exposure, most of the articles have talked either about rural programs or rural placements, and their impacts on rural recruitment. And the majority of the articles that have been included in the 41 have talked about voluntary rural exposure, where the student could choose to go on a rural placement track or within a rural course. Broadly, in some of the broad themes that we're starting to see already in the 41 that have been included in the full article review, is that there's very much a correlation between increased time and increased effectiveness in terms of the amount of time throughout their education where they have a chance to learn in and from rural preceptors or rural educators and rural community members. There's also a strong indication that rural placements and rural experiences have positively contributed to students' understanding of cross-cultural influences and that they understand, again, the community context much better. There's a theme also of the role of virtual learning, that the chance to connect with other learners. So while students might be in one placement, in one community, that they have a chance to connect and to learn about other rural communities. So the virtual education and learning still plays a strong role in their learning experience. The other thing that's a theme that's coming out in our preliminary review of the articles that have been included also makes this connection between students making connections with the community outside of the learning. So the chance for mentorship and connecting with community organizations outside of the structured learning environments plays a key role in their learning, in their positive experiences. Another theme is rural placements is showing to have a positive impact on urban students. So even though there's lots of mention in the literature about rural origins, there is evidence in the literature around the effectiveness of rural placements on urban origin students. And then really just a strong theme of rural leads to rural leads to rural. The idea of rural origins, rural placements, and the more time that students spend in rural communities learning about and in and from about their profession and that role of identity formation as they're spending more time in rural is a strong theme within our preliminary review of the literature. So really, to conclude, some key takeaways are there are now more emerging programs and there's more literature about the effectiveness of the programs. There's a real opportunity now and I think a call for sharing the development and evaluation of these programs. We need more evidence to support and to understand how these placements are affecting and helping to positively influence rural recruitment and retention. And there's a real focus in the literature on the types of educational approaches, so that we need more placements, we need more pathways, and focused on the time spent in these educational strategies. But predominantly, in one of the core themes that is emerging from this work is that there's a limited research on pedagogies. Pedagogies meaning the how. How are these working? Why are they working? And really needing more evidence to support what is about these educational strategies that is having a positive impact. So the time element, but what about the time, and also how is that helping support the competencies, skills, identities, and the positive attitudes towards the rural practice. So really wanting to focus on pedagogies moving forward in the literature. So here are some of the references from today's presentation that you can reference later. And just a big thank you for listening to today's presentation. And if you have any questions, here's my email to learn further about the study that we're undertaking. Thank you so much.